What is Invisalign?
So Invisalign is a clear aligner company. So what they work to do is they create clear aligners, which how they work is they essentially move teeth the same way that brackets do, but they do use a different kind of mechanism. So what clear aligners do is it's a series of clear plastic aligners that you wear for about 1 or 2 weeks at a time. And then whenever you switch to a new aligner, the teeth are in a slightly different position. So what this does is over a series of trays, we can work towards getting your teeth to the goal that we set initially.
How does Invisalign work?
Each aligner has the teeth in a set position. So whenever you switch to a new aligner, the teeth are adjusted very slightly. So that force that's enacted on the teeth will cause the teeth to move, right? So it's a similar concept to braces in that we're moving teeth. It's just a different mechanism, but it's just as effective.
Does Invisalign hurt?
For every time you switch a new tray on, you may feel a little bit of tightness as the teeth get used to the tray, but that's usually very temporary and very short-lived. For the most part, it's pretty mild and it goes away pretty quickly. So that's not something I would really stress about. The first tray may be a little bit sore, but after that, it's pretty smooth sailing.
How long does Invisalign treatment take?
It really depends. It's a case-by-case basis. So if for more complicated cases, it can take upwards of 18 months or even longer. But for most cases, we typically finish within 6 months to a year and a half.
Can I eat or drink while wearing my Invisalign aligners?
So with the aligners in, we don't encourage eating because it can cause the aligners to fracture. Drinks are for the most part are fine, but eating is what we discourage. The great thing about Invisalign is that once you actually remove the aligners, you're free to eat and drink what you want, which you typically don't get with braces. So that's a big advantage to the Invisalign aligners.
What happens if I lose an Invisalign tray?
So don't stress if you lose the tray. It's pretty easy to replace. You just call the office, let us know. In most cases, you can actually just advance to the next tray. As long as it fits well, then it shouldn't be a problem.
Is Invisalign better than braces?
I wouldn't necessarily say one is better than the other. They both have their own advantages and disadvantages, and they're both kind of suitable for certain situations. The benefits in Invisalign, though, is that because it's a clear plastic tray, it's definitely not as noticeable as braces are. For most patients, that's a big plus, and that's why they prefer Invisalign over traditional braces.
How much does Invisalign cost in the Brampton area?
So in the Brampton area, it can really depend, right? So it depends on the complexity of your case. So without knowing the case and how the teeth are positioned, it's hard to give an exact answer. But the fees generally can vary between 4,000 and 5,000.
Do I need a retainer after Invisalign treatment?
So we highly do recommend getting any kind of retainer. The reason is once the retainers or the aligners are off, the teeth will generally tend to shift back in the position that they started from. So to keep the smile that we worked so hard to obtain, we would recommend at the very minimum some kind of overnight retainer that you wear long term. But in some cases, we may even recommend a fixed retainer to keep the teeth in position a little bit better.
What should I know before starting Invisalign?
So the main thing I would say is that you need to be compliant with Invisalign. With braces, you don't have that worry because once they're on, they're kind of on. You don't really need to think twice about them. With Invisalign, you just have to make sure you wear them 22 hours a day, 7 days a week for the treatment to be successful.
How long have you been providing Invisalign treatment?
So I've been doing Invisalign since I graduated from dental school. So it's been about 3 years now, but I've seen quite a few cases and I've worked with different types of cases. So I would say I am pretty proficient, but always looking to learn more and gain more knowledge on Invisalign.
How many Invisalign cases have you completed?
I'd say at this point, I've probably done a little over 50 cases.
Do you use any special technology to make this procedure more comfortable?
So how the process works is we usually get the patient to come in the first visit and we do a consultation. So instead of a typical impression with the mold and everything, we actually use a scanner, which is pretty painless. It's quick and efficient, and then gets you a 3D image that you can see and visualize right away. So this process speeds up the whole setup time that Invisalign would usually take and really is great because it gets the patient involved on the journey as well.